He's our guy from Everett Bone and Joint. Dr. Jeff Mason joins us. How are you?
I am well.
We are going to talk about the calf strain that Félix Hernández went through. And my question when I saw that, how does, I understand a hack like me, playing basketball with friends or like running to get the mail and straining my calf. But how does like a well-toned athlete like Félix Hernández who, must stretch and work and do all that kind of stuff, how does that happen to him?
Well, I think it's actually emblematic of what baseball pitching is all about. I tell anyone who's willing to listen to me that in their way, baseball pitchers are the most freakish athletes of anybody. You think there's some guy who plays in the NBA who can jump 40-some inches, et cetera, and they're truly astonishing athletes. But to be able to not just throw a ball that fast, but particularly that accurately, but also to keep doing it for, let's say, 100 pitches a game every several days for any kind of career, what they do is at the very limits of what's physiologically tolerable. And the world's full of people who have, let's just say, a level of talent to throw that way, but by the time they were in their early 20s, their arm didn't work well enough to do it anymore. So every time one of these guys throws a pitch, they're sort of pushing the limits of what the body can do. So, and that's also why they get these injuries that seem completely inconsequential and unremarkable. And you might see the guy walking down the street. You say, "What do you mean he can't pitch?" Well, because for him to pitch, it's sort of 96 to 100% of what's possible every single pitch. And so if you just have some niggling injury that under other circumstances or even for other positions would be unremarkable and the guy would just be able to suck it up, if you're a pitcher, you can't.
Right.
You'd get out there and all of a sudden say, wait, they've got 9 hits on him in the first inning. And you say, well, gee, he looks okay, but everyone's hitting his ball. He doesn't have this, he doesn't have that. So calf injuries are very frustrating because they're one of those injuries that keep on giving, where even if they seem not particularly serious or painful, they take a long time to heal, even people who are fit and well-conditioned.
Yeah, and pitching, you were just describing it as mechanically freakish, and the idea behind pitching is you're taking energy that's coming up through the body and transmitting it out through the arm, through the ball, and this happens to be in his push-off, so there's a lot of torque and a lot of energy going up through that leg. And he might have just landed wrong, just one pitch that he landed wrong.
Yeah, every pitch is a big episode of acceleration and deceleration packed into a few short moments. And so if you can't push off, all of a sudden, all the rest of your mechanics will be affected. Or even if they're not, your velocity and your accuracy will be affected. It's just the whole thing is this grand kinetic chain.
And when that kinetic chain changes, you're predisposed for other injuries because your mechanics are thrown off, and you might sustain some overuse elbow or rotator cuff or something.
Plus, your release point is all
absolutely,
different,
yeah, mechanics, right.
Right. You're talking about pitchers getting freakish accidents. That's why, like during a game, the guy will have to come out because he has a blister on his little finger, and that kind of changes everything.
Everything, yeah.
Right. And for so many other athletic activities, we just say, well, just tough it out, and the guy wouldn't even come. Wouldn't even come to the bench. But for pitching, it's not a matter of whether he. A lot of these they don't want to come off the field, but all of a sudden, the manager's saying, wait, why did so and so just give up 4 hits in a row?
Right.
Well, it's because he's got this little injury. He's not even trying to protect, but he can't help it.
Right.
Doesn't that make it more amazing when a pitcher comes back after having Tommy John surgery?
Oh, it's all amazing.
And is, an all-star?
It is. Yeah. It's remarkable.
Yeah.
Well, the calf muscle, it's one of those things like Maury's little finger. Until it's hurt, you really don't appreciate it. But calf muscle is active just standing. And then when we walk, stop, push, pull, whatever with the lower extremity, it's there.
Oh, you're absolutely correct. I always tell people, if you want to know what the calf muscle really does for you, go to the gym and do some calf exercises to the point of exhaustion. Say, I did 20 reps, and then I did 20 more reps, and get up and try to walk across the room. And you're sort of weaving around like, you're barely able to not pitch over on your face. That's what your calf muscles do for you every step.
Yeah, and it's complicated because when we talk about the calf muscle, we're actually talking about 2 muscles. We have, the gastrix, and then we have the soleus, which are different. They cross a joint. They cross the knee joint. One does and one doesn't.
Yeah, and then they both connect down on the heel bone through the Achilles tendon, and they, like I said, they're very powerful and they're very fatigue resistant. But when they get injured, they tend to heal quite slowly.
Yeah, and wouldn't you agree that part of the problem with they are working a lot in deceleration, which is eccentrically contracting, which is different than shortening. It's a lengthening contraction.
Yeah, we see more injuries actually in deceleration, and I don't know what his specific mechanism of injury was, but that would be what I would be suspect, given that I don't actually have specific information.
I thought I read where he heard it just working out or just warming up or stretching.
Oh, I would believe it without hesitation.
Yeah. It is for me, it would take forever to heal from a calf. Is it different for like a pitcher as far as, what I guess what I'm saying is, what do you do then?
Well, it's a little bit different only in that he's young and he has constant treatment.
Right.
But remember, they put him on till the middle of June, and now all of a sudden they're saying, well, it's going to be beyond that.
Yeah.
So even something that probably never seemed like much of an injury when it first happened, all of a sudden we're already talking about 3 weeks of not pitching and hopefully not more. So,
and it's the point is that it's a soft tissue injury, and it just takes time. The body has to heal it.
Exactly.
And they're working on it. He's getting treatment every day. But if you come back too soon from a calf strain or any kind of strain, you can irritate it again, and this then becomes this chronic problem that can hamper you throughout the season.
yeah.
I mean, I'm sure they're trying to get it resolved early on.
No, I tell my weekend warrior friends when they have a calf muscle pull, especially if it's a significant one, I say, you're not going to like this, but long after you feel like you're okay when you're walking around doing your daily affairs, then you'll do something a little bit different, or maybe it's time to go skiing, and you'll realize that you're only about 2/3 healed. And you're fine when you're walking down the street and even going up a few stairs, and then you say, I'm going to go for a run, or I'm going to try to play basketball, or I'm going to try to ski, and you realize that even though this injury was months before, that you've only recovered, 60 or 70%.
So treatment besides Bengay, what's the
Bengay.
What's the treatment for calf?
Well,
strain?
Yeah. I mean, you're going to calm it down. You're going to work on anti-inflammatory, decrease the swelling, help the body, promoting healing. Gradually start some stretching and not irritate it. You don't want to cause any pain. And then you start working on strength and then functional activity. I mean, he'll go through a whole series of functional testing before he can get back to the mound. I mean, really what you're trying to do is help the body heal that soft tissue so it's nice and healed and tolerates increasing activity. That's really what you can do.
Yeah, I mean, the notion was years and years ago that if you had a significant muscle tear, and I'm not saying that that's what his injury is like, but if you had a bad muscle pull, you would tear the muscle, and they used to be treated decades ago just by resting the heck out of it for the most part and doing some light stretching, and people had a much greater loss of function, and now we've realized that if you can sort of keep that muscle working enough to help stimulate the tissue that's supposed to be healing without overdoing it, that you can actually have return and strengthening of the muscle fibers, and you can actually get much better recovery than people enjoyed quite a while ago.
Yeah, because a little bit of stress through that muscle tissue promotes healing, and it's good for the proper healing.
Exactly.
And scar tissue formation. I mean, and like Dr. Mason was just saying, I mean, it depends on how severe it is. I mean, in my world, we usually grade these things grades 1 through 3. And this is probably a moderate strain, would you assume?
Yeah.
I mean, not a severe one where if they're talking about coming back mid-June, possibly sooner, I mean, it is usually, a 6-week healing time?
Yeah, I mean, if it was a bad strain, you'd assume at least 6 weeks, so we're hoping that this is a little bit more.
And is it something that because this happened, somebody who suffers from this, is it something that's going to happen again and again and again?
Well, that's always an issue. I mean, any of us who are aging athletes have little aches and pains that we literally remember say, oh, I remember this happened to me when I was 22 years old, and it get 95% better, but it still hurts a tiny little bit.
Right.
I don't even remember 22.
Yeah, we'll work on it.
Dr. Jeff Mason, Everett Bone and Joint is what I'm trying to say. Everett Bone and Joint, ebj.com is what you want to go to for more information. Thanks so much for coming on.
My pleasure.
We're taking a break. We're back. It's Health Matters, brought to you by IRG Physical and Hand Therapy. This is Fox Sports 1380.